Okay, so the recording has started. I'm gonna pull up the PowerPoint slides. Okay, can everyone see my screen?
I can.
You can? Okay, thank you, Dana. Okay, can you still see the PowerPoint?
Yeah.
Okay, thank you. Okay, so today we're going to talk about the future of rural dental care, all specialty areas. And we are with Upper Great Lakes and the Upper Peninsula Area Health Education Center. So here with me today, I have Dr. Colazzo. She is our dentist who's practicing and our dental director who's practicing out of our Sawyer location. We have Jamie Goff, who is a registered dental hygienist who's working out of our Iron River location. We have Emily Royce, a dental assistant who is working out of our Sawyer location with Dr. Colazzo, and Dana Obey, who's been a dental assistant, who is currently in a dental therapy program and will be a licensed dental therapist, which is a new discipline we'll discuss a little bit today. And then myself, Shelby Santee, I'm the workforce development manager with Upper Great Lakes Family Health Center. And we also have Sean Boudry on the line. He is he covers provider recruitment and relations at Upper Great Lakes Family Health Center, and he'll have a lot to talk about loan reimbursement and whatnot. But a little bit of history or explanation about what we are. We refer to ourselves as UP-AHEC, which is the Upper Peninsula Area Health Education Center, which is HRSA, or Health Resources Services Administration grant-funded program. And we focus on primary healthcare provider recruitment, retention, workforce development, training, and education in the Upper Peninsula. And our host partner is Upper Great Lakes Family Health Center, which is a nonprofit, federally qualified health center, or FQHC, that offers integrated medical, dental, and behavioral health services to all, regardless of their ability to pay. So we do cover in care for all individuals. So part of the reason we're here today, there is a dental care provider shortage across the nation and in the UP, so of all disciplines. So dental hygiene, dentists, dental therapy is a new area, and then dental assisting. So we're here today to inspire you guys, our own local youth, to pursue health careers in dental, and inspire you to believe in yourself, to move forward and pursue education in dental hygiene, as a dentist, as a dental therapist. So I did include some locations here. So dental hygiene schools that are closest to us right now. There's some in Wisconsin, North Central Technical College and Northeastern Wisconsin Technical College. Some of them don't require a wait list. They have a placement test. So it's a HESI where you have to sit and take an exam and get a decent grade on that 75% or higher. And that helps you get in quicker. Whereas some of the other ones in Lower Michigan have longer wait lists. And I did want to make note that Northern Michigan University, fingers crossed, I'm really hoping this goes through. They're doing a feasibility study now to see if they can make it happen, but they're hoping to open a dental hygiene program here in the UP, which will be an awesome opportunity for us Upers, and for people who want to pursue career development. Maybe they've been working as a dental assistant for many years, And they were wanting to use that as a stepping stone to go into dental hygiene or just helping us meet that need in the UP because it's an issue, with colleges being a little bit far away for us. But those ones in Wisconsin are a little bit closer than Ferris, and um, I'll send an email following this presentation with information about the schools. And then dental schools in the state of Michigan, there's the University of Detroit Mercy and the University of Michigan. But in Milwaukee, there is Marquette University. And then dental therapy programs. Dana will talk quite a bit more about this later. But there is a program opening in Lower Michigan. Ferris State University is going to be the first accredited program in the state of Michigan. I'm not sure exactly when that will be available. And then currently other states that have dental therapists and use them regularly is Alaska, Vermont, Washington, and Minnesota. And it's such a new discipline, at least new to Michigan. I kind of, you know, just describe it as like a mid-level or a nurse practitioner or physician assistant, but in the dental world. So they have more ability and skill than a dental hygienist, but not quite as much as a dentist. So they're a mid-level provider. And then dental assisting. Here at Upper Great Lakes Family Health Center, we have a dental assistant apprenticeship program. It was the first one in the state of Michigan. It results in a certificate of completion for dental assisting. And then there is a career pathway. I'll discuss a little bit more about that later. And then Bay College does have a dental assistant program. So one other thing I wanted to bring to your attention today, especially for the academic advisors, this is a relatively new website. And I'll share the slides afterwards just for time saving purposes. But the Michigan Health Council has an occupations webpage, and it shows a ton of useful information about the most high need areas. I know it says cardiovascular technologist at the top. I just took a screen snippet, but this link will allow you to view a comprehensive information on healthcare occupations, including current workforce data, relevant legislation, hourly wages, job titles, employment statistics, related initiatives, career pathways. So they're doing a really good job of showing that current up-to-date statistics on high need areas, and they provide information on the career path. So I've been trying to promote it with many of you and just sharing it out. If I were to pull this website up right now, you would see right at the top, dentist, dental assistant. I mean, it's a needed area across the nation. So I wanted to make sure to bring that to your attention, and I hope that you guys are able to start using that and implementing it in, your day-to-day practice and guidance with your students who are in career exploration. And right now I'm going to hand it off to Dr. Colazzo. Like I said, she's our dentist and dental director at Upper Great Lakes Family Health Center, working out of our Sawyer location. And Dr. Colazzo, when you need me to move to the next slide, just let me know, and you can say next slide, please.
Okay, sounds good. Hi, everyone. Like Shelby said, my name is Dr. Colazzo. Today, I'm going to be talking about a little bit of the steps that you have to take to become a dentist, what an average day as a dentist is like, and why you should consider a career in dentistry as well. Next slide, please. So as you can see in this picture, one of these pugs does not belong with others. And like I'm sure most of you have guessed, I am not originally from the UP. Next slide, please. I was born in Pennsylvania and lived there till I was 10 years old. Next slide. In 2003, I moved to Puerto Rico with my grandparents, where I did the rest of my schooling, and I graduated from college in 2015. Next slide. That same year, I moved back to Pennsylvania for dental school, where I graduated from the University of Pennsylvania and also completed a master's in public health in 2019. Next slide. After that, I moved to upstate New York to do a one-year residency program. In my senior year of dental school, I received an award from the National Health Service Corps to help pay off some of my student loans. And in exchange, I had to work in an underserved area for 3 years. During my time in residency was when I started looking for a place to fulfill my service commitment. And that's when I found an ad for a full-time dentist position in the UP, and how I started working for Upper Great Lakes Family Health Center in July of 2020, right in the middle of COVID. And next slide. Initially, when I moved to Marquette, I came with just my cat Tiger, whose picture you can see on the far left. But since moving here 5 years ago, I've acquired a few more pets. Ellie is the cat next to Tiger. Then we have Anubis, and the last to join the group is Arya. Next slide. So next I'm going to be talking a little bit about the steps in becoming a dentist. So once you're in college, there are some general prerequisites that you need in order to apply to dental school. The exact details may be a little different for each school, but in general, you need all of these things that I'll be mentioning now. Most people who apply for dental school have a bachelor's degree and a major in some sort of science. For example, I did my bachelor's degree in cellular and molecular biology, but it's technically not necessary to major in a science as long as you have the required courses, which are general biology, chemistry, biochemistry, physics, math, and English. You can technically major in whatever you want, or you don't necessarily have to complete a bachelor's degree. You can just take the necessary courses. But although some schools will allow you to apply without a bachelor's degree, you still have to have a certain amount of credit hours. Ideally, to be a competitive candidate, you want to have a decently high GPA, especially good grades with those prerequisite courses. There's also a test that you have to take to apply for dental school, which is called the Dental Admission Test, or the DAT. The subjects that they cover in the DAT are biology, general chem, organic chem, reading comprehension, quantitative reasoning, and the perceptual ability test, which in my opinion is the most fun part. In the perceptual ability test, they have you answer questions that deal mostly with spatial recognition. And the reason that they do this is because as a dentist, you need to be able to work and move in different ways, such as using indirect vision. So for example, when we're drilling a tooth and looking through a mirror, you're moving essentially backwards. We also have to work in very small spaces and with very tiny increments, such as millimeters. The next thing that they have you do is spend a good amount of time shadowing in a dental clinic. They usually request at least 100 hours of you observing a dentist or a specialist work. And lastly, in order to be a strong candidate, you also want to make sure that you engage routinely in extracurricular activities, joining clubs, especially a pre-dental club, doing volunteer work and or research. You'll also have to submit a personal statement, get recommendation letters, and if a school is interested in you as a candidate, you will have to do an interview. Once accepted, dental school is 4 years long, and once you've graduated, you'll be able to practice as a dentist. Okay, next slide. Okay, so next I'm going to give you guys an overview of what an average day as a dentist is like, but particularly of one that works in a federally qualified health center where we mostly see underserved patients. The bulk of my day is doing phase 1 treatment. Phase 1 is the most important part of a patient's treatment. That's where we go over prevention and disease elimination. We do patient exams, go over oral health education and nutrition counseling, so patients are able to take ownership over their own health and ideally prevent decay and disease from occurring again. Cleanings, extractions, and fillings are all part of phase 1 treatment. Emergencies technically aren't phase 1, but we treat a good amount of emergencies in a day. So on average, 4 to 5 emergencies are in our schedule daily. And next slide. To do a proper exam, we need to take x-rays. This is an example of an x-ray we would take in the clinic. This particular x-ray is called a panoramic x-ray. This allows us to see all the patient's teeth at once, including the ones that are still developing, such as you can see here. This x-ray is of a child. You can see some of the adult teeth haven't come in yet. So from the baby teeth that this patient still has and the adult teeth that haven't erupted yet, I would guess that this kid is probably 8 to 9 years old. Next slide. Here are some more panoramic x-rays. The one on the left has all of their adult teeth, but it looks like their wisdom teeth are still developing, so they're probably an older teenager or young adult. And then the one on the right is an x-ray of someone who is missing almost all of their teeth except from the one canine on the patient's upper right. And next slide. A couple more examples of x-rays we take in the clinic are bite wings, the ones on the left, and periapicals, the ones on the right. These x-rays allow us to see the teeth in better detail, and these are the ones that we would use to diagnose and determine what treatment is needed. And next slide. Something that we unfortunately see a lot of in the clinic are cavities. Next slide. If not treated quickly, cavities can lead to infections, which can remain local, like in the example on the left, where the patient just has an abscess on their gums, but sometimes they can become dangerous. On the right, you see that the woman's upper cheek and eye is swollen, which, if left unchecked, can reach the brain, or sometimes patients can get really swollen under the jaw to the point where it compromises their airway, which can potentially stop them from breathing. These infections can also become systemic, which is when the infection spreads into your bloodstream and can become deadly. Next slide. So ideally, we want to prevent disease from happening, which is why it's important to go see your dentist every 6 months so that if something does happen, we can catch it before it becomes an infection. However, if a tooth does get a cavity that has not reached the nerve of the tooth, we can do a filling. And essentially here we remove the cavity until we reach healthy tooth structure and fill the tooth to restore function. Next slide. If a cavity has reached the nerve and the patient is experiencing extreme pain and or has an infection and cannot get a root canal, or if a tooth is broken beyond repair, then we would have to do an extraction. Next slide, please. Once the patient is done with their phase 1 treatment, we can move on to phase 2 treatment, and this primarily consists of restoring function. So for example, replacing teeth so a patient can chew more easily. Slide. In phase 2, we do crowns and bridges. Once a filling has become so large that there's more filling than natural tooth, we often opt to do a crown to help prevent the tooth from breaking. A bridge is when we replace a tooth by crowning the adjacent teeth. So as you see in the image on the right, there is a missing tooth, and the teeth on the left and right of that space get crowned so that we can then cement the bridge on top of those teeth, and then you have a tooth in the middle again. And those 3 crowns are fused together. Next picture. So here's a picture of someone who has gotten crowns and bridges. On the left, she has a bridge that replaces the tooth between her canine and front tooth, and the rest of the teeth on the right also have been crowned, and it looks like she has a bridge on the right as well to replace those missing teeth in the back. Next slide. So when patients are missing multiple teeth, we usually fabricate partials. When they're missing all of their teeth, we do complete dentures, which is what this puppy currently has in its mouth. This picture also illustrates why we tell patients to make sure they keep their dentures away from their pets because they love to use them as chew toys. Next slide. So in this picture, it looks like the remaining upper teeth of the patient have been extracted, and they made him a full upper denture, and on the bottom they made a partial to replace those missing teeth. Next slide, please. Another thing we do in the dental clinic, which is very important, is oral cancer screenings. Ever since I've started working as a dentist, I've seen a handful of oral cancer cases, which can be pretty scary. These patients will typically then get referred to an oral surgeon to have the cancer removed. In these cases, on the left, the patient would have the right side of their tongue removed, and on the right, the patient will probably end up losing a big piece of their upper jaw. And next slide. So lastly, I'd like to highlight why you should seriously consider a career in dentistry and how you're in the perfect area to truly make a significant difference in your community. Next slide. So in the entire country, there is a massive workforce shortage in dentistry, including dentists, hygienists, and dental assistants. This lack of providers leads to places that are termed as health professional shortage areas, or HPSA for short. Essentially, what this means is that if you're in a HPSA, there are not enough healthcare providers for the population in that area, which then greatly reduces the ability for the people in that area to be able to access care. This is a map of Michigan from 2019 that shows the HPSAs in the state. And as you can see, all of the UP is comprised of HPSAs. The scores can vary depending on the specialty, so there are specific scores for dental, medical, and mental health. As of December of 2024, Michigan has 256 health professional shortage areas, and the darker the color, the more need there is. And next slide. As of right now, there are around 200,000 practicing dentists in the US. Of that number, only a little over 5,000 work in public health in those HPSAs, which means only about 2% of all dentists work primarily with underserved areas. This article is regarding the Delta Dental Foundation. This foundation is a nonprofit organization which is part of the insurance company Delta Dental. The foundation helps provide funding to increase access to care for those who are most in need. This article highlights their awareness of the issue, specifically in Michigan, particularly in the UP. Specifically in Michigan, there are 245 dental health professional shortage areas, the majority being in rural areas. The article mentions that it would take 300 dentists to eliminate those shortage areas. So to help reduce this burden, the foundation fundraises to provide scholarships for dental providers or dental students who would then be working in rural areas, which I received one of their scholarships in dental school. And they just also recently launched a new student loan repayment program to incentivize dentists to work in those rural areas as well. Next slide. And that's it for me. Thank you for your attention.
Thank you, Dr. Colazzo. That was wonderful. I really appreciate you emphasizing the opportunities that are available with the student loan reimbursement and scholarship programs. Okay, so next is Jamie Goff. She's a registered dental hygienist in, like I said, working out of our Iron River location. She has many years of experience and she will be covering dental hygiene.
Hi. Hello, everyone. As Shelby said, my name is Jamie Goff, and I'm a registered dental hygienist. I've been practicing for the last 9 years, with the majority of it being in public health in the Upper Peninsula of Michigan. And today I will be discussing how you become a hygienist and what I do during my day. Hi, so I grew up in the Lansing area, and I always knew I wanted a career working with patients. Out of high school, I had started going pre-med, but life happens, and I ended up taking a much longer break from school than I had intended to. Thankfully, I did get myself back into school, and I entered the dental hygiene program with Lansing Community College in 2014, graduating in 2016. When I graduated, there was an abundance of hygienists in the Lansing area, and I couldn't find a permanent office. I subbed for a few different offices every week while I was expanding my search. was open to relocating, and I was recruited to the UP in 2017, and I've been here since. All right, so in this pick, I just picked up my books and scrubs, and I was very excited to be starting the dental hygiene program. And I even got to go through the program with a close friend, which is a great experience. I really like providing education to my patients while providing their preventative care. Nationally, now there is a shortage of hygienists, so we are in very high demand. So if you do become one, know your worth even as a new grad. So dental hygienists in Michigan work under the direct supervision of a dentist and work directly with a patient. As in, I have my own column of patients I see a day. You must become licensed to practice, and it will take about 4 years to finish school and to take the board exams. You will also earn certifications for providing local anesthesia and nitrous oxide. In underserved areas such as the UP, a public health clinic such as my office can apply for expanded rights for the hygienist to see patients without a dentist present. In Michigan, hygienists cannot own their own practice. So I'm going to discuss how you get chosen once you've applied to a program, the difference between a 2-year and a 4-year program, and the costs involved. I'll be using Lansing Community College as a reference for the 2-year program. During my time there, LCC and U of M were considered some of the best hygiene schools in Michigan, and that's still the case today. Right. For the LCC program, you must take prerequisites prior to being able to apply, which can take around 2 years to complete depending on the pace you take them, being 34 credits altogether. Then the hygiene program is another 2 years. There isn't an informational seminar that must be completed within 2 years of applying for the program, but I would recommend attending it early on. This shows the list of prereqs for LCC and how their applicants are chosen. For every one of the prereqs you take, your final grade earns you a set number of points. Additional points are awarded for already having a degree or for having a certain level of experience in a dental office. Your final points are ranked against everyone else who applied for that year, and then the 24 applicants with the highest points get chosen for their program. Now, 4-year colleges versus a community college will structure their program in 1 or 2 ways. They may also have mandatory prereqs to be completed prior to applying to the hygiene program and would have a similar point award system like LCC does to determine who gets chosen. Or the 4-year college will not have prereqs, but spread those additional courses throughout their 4-year program, and entry this way would be by a waiting list only. If you think you'd like to do anything past a clinical setting, then consider going to a 4-year college that offers a bachelor's degree versus a community college that gives you an associate's degree for the same amount of coursework. This is something I never considered, but being that I lived in Lansing and they have a highly rated program, I most likely would have still chosen them. But for a clinical setting, there's no difference in pay between having an associate's or a bachelor's degree. However, having a bachelor's allows you to become a teacher or an instructor at a hygiene school, or it will make it easier for you if you ever wanted to go back to school to become a dental therapist or a dentist. It is important to understand the cost of the program and the loans you may take out. There are scholarships you can apply for. LCC offered several, and I was awarded a couple of them. I believe it was around $1,500 in total. Today, there are additional resources for scholarships. Currently, Delta Dental has some available for hygiene students for up to $10,000 per year. If you are taking out student loans and you make payments throughout your time in school, it will reduce the amount of interest you have accrued by the time you graduate. From this current chart for LCC, if you live in district, the total cost, including the board exams, is just over $43,000 versus in-state for $58,000, or if you lived out of state, then it'd be around $74,000. There's also an opportunity for student loan repayment to work in an underserved area that will be discussed later in this presentation. I was awarded the loan repayment. Since I was from in-district of LCC, I owed about $50,000 in loans, which included money to cover rent and living expenses. And I only had to pay about $6,000 back. And then the loan repayment covered the remainder for a 2-year contract. I was not aware of this opportunity until after I graduated. Right. So this is me practicing taking x-rays. We named our practice guy Dexter. And I can still remember how long it would take us just to take a single image. There was a girl in my class that happened to be an assistant prior to starting the hygiene program. So she already knew how to take them, and she was a lot faster than the rest of us. For our radiology course, we did get timed, so she had a really good advantage. All right, and this picture is also of our LCC clinic. There will be multiple operatories for students with instructors checking in with you. You must pass an instructor's check before you move on to the next part of the appointment, such as after you finish reviewing the patient's medical history, you get checked, and then after you complete the assessments, you get checked, and so on. Each semester, we are allowed to accomplish more of the appointment in between being checked. Our first patients took 8 hours to complete between 2 4-hour appointments, versus by the time you graduate, you'll need to complete most patients within 2 hours. And don't worry, you get to practice on your classmates before you see your first patient. While I was in the program, a first-year students will be paired up with a second-year student for mentorship. At LCC, referred this to as bigs and littles. During my second year, my class would still often message our bigs to ask questions, and I still have contact with mine today. Our classes and clinic days were Monday through Friday, except for the last semester. The last semester was structured to be fewer hours, so you have more time to study for the board exams. Organization and time management are very important throughout the program. Think about finding study partners or consider living with somebody else that's in the program. My second year, I moved in with a classmate and found it very benefiting. We often studied together and quizzed each other. Okay, so a typical day includes setting up your treatment room, chart prepping, performing the cleaning, patient education, sealants, taking x-rays, having the dentist come in for the exams, chart notes, and cleaning up your treatment room. We also help with the sterilization of instruments and general maintenance. Some offices will also have you help with referrals and prior authorizations. There are different levels of cleanings, and some require us to provide local anesthetic, which will numb the area that we're working in. Not all offices will have nitrous oxide, which is commonly known as laughing gas. Hygienists can only administer local anesthetic and nitrous to adults while a dentist is physically in the office. Even though each day will have the same structure, every patient is unique, which helps keep my day from feeling so repetitive. So every office is going to vary by what hours they are open, pay, and benefits offered. Find an office that's right for you. If the office isn't a good fit, don't be afraid to leave. I like working in public health because I work with a more challenging patient population. The UP is a highly underserved area with a high rate of disease. So I find my career very rewarding, and I love helping people achieve a healthy mouth. I also enjoy being able to do outreach events, such as attending health fairs. I've done many of them over the years. This picture is from a parenting fair at my local library. We also have a mobile dental bus that we will be using soon. So while you're still in high school, you could get a job at a dental office working in the sterilization room or as an assistant. This would give you a good feeling for how the dental office runs and see if it's a career that you'd like to pursue. As I spoke about earlier, it may also earn you more points on your application. All right, well, thank you for listening.
Thanks, Jamie. I appreciate you going through the process of, figuring out the career path for yourself, because not everyone's a traditional student. There's a lot of non-traditional students, and that's something I'll talk a little bit more about later. Career path and starting and just using different specialty areas as stepping stones. I liked the little bit you added about the other girls in the program who had worked as dental assistants in the past and having a little bit more experience. Our dentist at our Calumet location, Dr. Leonard, actually started out as a dental assistant before she decided to go to dental school. And then another little piece of information, you highlighted on outreach a little bit, but Upper Great Lakes Family Health Center, we do have a dental bus. So that is where we will travel across, the region and go to high schools or communities that don't have access to dental care. So the hygienist and the dental assistant would typically be the ones doing that. So if that's interesting to you at all. Yeah, thanks again. And now, Emily, you're up. Emily is our dental assistant, like I said, working with Dr. Collazo at our Sawyer location. And she was our very first dental assistant apprentice to go through the program. And I'll talk about that a little more at the end of Emily's session. But I'll let you take it from here, Emily.
Okay, Thank you. You can go on to the next slide, actually. So a little bit about me. My name is Emily Sorois. I have been a dental assistant here with UGL for about a year and a half, including doing the apprenticeship and also on-the-job training. So I did the career step dental assistant coursework. And then along with that, I did do the dental assistant apprenticeship as well. A little bit more about me. I am originally from the Houghton area. I moved down here in about 2020, and I've been married to my husband for 2 years now. We have our two beagles, Cooper and Loki. And then we're expecting our first baby soon here in June. So talk about being a little nervous about that. But so that's a little bit about me. You can go on to the next slide. So starting out, I actually accepted the position as being the dental scheduler for Sawyer Dental in August of 2023. And I was not gonna lie, I was a little scared to not only be like the dental scheduler, but also to become a dental assistant, just because I had suffered a few traumatic accidents when I was younger that really affected my teeth, and I had to get a lot of dental treatment done in order to restore them. So because of those accidents, I had suffered a lot of dental anxiety to the point where I was afraid of going to the dentist. So when I approached becoming a dental assistant, wanting to do more on the job training, I kind of used that anxiety to my advantage, because I know that the dental clinic is somewhere that lots of people don't want to be, because of all the treatment, that they may have to come into contact with. So I wanted to be kind of an advocate for dental anxiety and be that comforting presence that a patient may need, while they're here, whether it be just having a simple conversation with them, or, possibly holding, a little child's hand during a procedure. I really just wanted to make sure that they felt comfortable and safe while they were here. You can go ahead to the next slide. So day to day, we have many different job duties that we do. One thing that I really enjoyed, especially doing on the job training, was the pleasant work environment that I had. I really kind of threw myself into just going into each procedure and learning, whether it be just watching or, assisting and having someone watch over me and kind of lead me along the way. That's basically the best way to do it, is kind of just to jump in and learn along the way. So I did receive my certificate of completion through the apprenticeship. You don't need a license to be a dental assistant. You can become a certified dental assistant, but it is not required. Lots of places do on-the-job training like here, but I did get the certificate of completion through the program that I did. I'm able to help people throughout the day. You do need x-ray certification while you are a dental assistant, because you do need to be able to take x-rays like the ones that Dr. Collazo had shown you. And then another benefit is you don't work any holidays or weekends, which is really nice. And we can go ahead to the next slide. So I began the Career Step DA apprenticeship program in November 2023 and completed it in April of 2024. There are different programs, or I guess time frames, as to when you can complete the program. I can't remember exactly what I had signed up for with Shelby, but I know that I finished it early. And it was nice because I was able to create my own study schedule outside of work, but also be able to take what I was learning through the coursework and apply it to on-the-job training. So it was nice being able to have mentors like the other dental assistants that I work with, along with Dr. Colazzo to help, because I was able to take all the information that I had learned and actually put it to use the next day, which was really, really helpful and able to obtain more of that information. And you can go ahead to the next one. So a typical start of the day for a dental assistant, we set up our rooms for the very first patient. We typically do what we call is like bleeding our lines. So kind of getting rid of, if there's like any bacteria or anything from the previous day, we run water through them to clear them out from anything of the night before, which we do run our lines at the end of the night too. We turn on our x-ray machines. We turn on any of our pumps for our lines. We do set up for various appointments throughout the day. So like extractions, filling appointments, emergency appointments, dentures. They typically range throughout the day. So, and if there's a cancellation or whatnot, something else is placed in there that we'll set up for. We will also work in our laboratory, working on sterilizing instruments and packaging them, making sure that they're all organized so that when we need them, we know exactly where they are. At the end of the day, after the last patient, we run our lines again with a special cleaner. We turn off, our x-ray machines and any other pumps, and make sure that all the charting is completed on the patients that we assisted with Dr. Colazzo. And you can go ahead to the next one. And then
So,
Shelby can talk more about the dental assistant apprenticeship program that I did.
yes, and at the end, there's going to be an opportunity for Q&A. So thank you for covering that, Emily. I appreciate that. So a little bit about the dental assistant apprenticeship program. Like Emily had mentioned, the program is online and self-paced. So, a little bit about the program is there's an opportunity for career growth. So, some offices in the state of Michigan just do straight up on the job training and there's no additional coursework to go on with along with it. That really provides, foundational knowledge of understanding a little bit more about why you're doing the skill that you're doing. So I think that's super important. You're getting a little bit more information, safety related and whatnot. And that's super important to the provider that the dental assistant is helping. You come out with an industry recognized certificate of completion after completing the online coursework. But there is a career path later on if you did choose to move forward and do the certified dental assistant program. It's a certification in the state of Michigan, and there is a hybrid program with Washtenaw Community College in Lower Michigan, where you would have to go down there one time. It's just one semester long. So as long as you have, I think, 2 years of experience working as an uncertified dental assistant, you would be eligible to prepare for the CDA, which is a Certified Dental Assistant exam, prepare for and take that, which, takes a bit of studying, but after working for 2 years, you'll have your feet wet and have a better understanding of the field itself. We would be able to support you in getting your CDA, and then after that is when you would be able to apply for the registered dental assistant course with Washtenaw Community College. And that's when you would go down to Lower Michigan for 1 weekend. And then after that, they work with rural communities in the Upper Peninsula, and they'll actually come to the UP for the midterm. So it's a 1 semester course at Washtenaw Community College. Like I said, you have to go down there for that 1 weekend, and then they come to us. You take that course, and then be eligible to get your registered dental assistant. So that's the career path opportunity for a dental assistant. But the apprenticeship program at UGL, there's paid tuition, so we cover that. It's an online self-paced coursework, so you can do that on your own time. After hours and on the weekends. And Emily had a perfect example. I know she set up her schedule to be a couple of days a week in the evening, and then she specifically made sure to wake up super early on Saturday mornings to get a lot of the coursework done before her husband or her dogs were able to interrupt her. So it caters to the non-traditional student who, college isn't for everybody. Technical schools and apprenticeship programs are becoming more and more popular. You're allowed to earn wages while you learn, so you can start practicing and learning on the job training and the skill and get paid while you're doing your coursework, an online self-paced coursework. So it may not be for everyone, but it certainly is for people that already have life happening, or like I said, just, traditional academic institution isn't the way you want to go if you're worried about, certain barriers. But a benefit of working at Upper Great Lakes Family Health Center would include excellent benefits, paid time off, health insurance, and retirement. And then being that we're a community health center, we offer work-life balance. So we have no evenings, weekends, or holidays. And just a little bit more information about what a dental assistant does. I think Emily did a really good job discussing that, but it supports dental clinic flow, and you're assisting the provider, whether that be the dentist, the hygienist, or the dental therapist. During procedures, you prepare treatment rooms and patients, comforting them and making sure that they feel welcome and whatnot, sterilizing instruments and maintaining dental equipment, like Emily mentioned, taking the x-rays and updating patient charts, providing patient education and supporting community outreach. So if you were to work with the dental hygienist on the bus, for example, or just like we're doing today, and promoting, dental careers, or, helping make sure our community and the patient population that we serve here at UGL is aware of us. And then maintaining inventory, ensuring infection control, compliance, and assisting with front desk duties. What that means is you're going to be the expert for understanding, how long a certain procedure takes. Some procedures, simple cleaning might not take very long, or an extraction of many teeth might take much longer. So just working with the dentist to figure out where that next follow-up appointment should be and whatnot. And I'll send this after the presentation as well. We do have an opening at our Iron River location for a dental assistant apprentice. And I do think that we will probably have openings, regularly. So you'd always want to check the uglhealth.org website for the most up-to-date, open positions, because it's ever changing. I know some of you may be, juniors right now, and, in the process of making career choices. So this is an option for you. And I would be happy to share out. And I think I mentioned this to some of the Copper Country ISD students who are currently shadowing at our Calumet location. I will make sure to include the health career instructors on the invites in the future when we do an info session where we delve deeper into the program itself and mandatory meetings and all the requirements and whatnot. So anyways, that's a little bit about the apprenticeship program specifically. Emily, did you have anything else to add before I move on to Dana with dental therapy?
Dana, the floor is yours.
Okay, thanks, Em. Okay, so like I said, Dana Obey is a longtime dental assistant who has decided to go back to dental therapy school. It's a new discipline in the state of Michigan, but it isn't new in Minnesota, Alaska, Washington. I forget the other one, but we should, see it more in the future. And Ferris State University is the current school that will be opening the first accredited dental therapy program in Michigan. I don't have a timeline on that, but I'm hoping they can have all of their ducks in a row in the next couple of years. So pay attention to that, and I will hand it over to Dana.
Thank you. You can go to the next slide.
Okay.
So my name's Dana Obi, and I have been in the dental field for about 16 years. I'll be the first licensed dental therapist in the state of Michigan. Primarily, I focus on minimally invasive dental procedures, and I'm currently working in Michigan's Upper Peninsula in Sault Ste. Marie. I'm a mom. I have 4 children. I have 3 boys, a set of twin boys and a little girl. I chose dentistry as my career path because I had limited access to dental care as a kid. And then I also experienced a little bit of dental trauma that it stayed with me for a really long time. So I felt like this was really the avenue that I wanted to go because of what I went through as a kid. Next slide. So I attended high school, and during my high school career, I really worked with a lot of kids just because it was pretty natural. But I had taken an aptitude test, and it revealed that I would do best working with kids. And so during that test, it kind of like it outlines what you might want to do as a career. And so the 2 areas were either to be a teacher or a therapist. And ironically, I'm kind of both. So next slide. So after high school, I did go to a community college, and I tried it for about a year. I wanted to go and be a lower elementary school teacher, but at the time, I really struggled with the coursework, and I guess really just the amount of time that I had to invest in going to college. It just ended up not being something for me. I really wanted to make money right away, right out of high school, and then I chose to take some time off. I don't recommend that, but I did it. And so I later, a few years after that, ended up having kids. And so that took me on a completely different path. And I ended up going to a trade school in the area. And I completed a 2-year program for dental assisting. Once I completed that, I worked as a dental assistant for about 10 years. And I was in and out of private practice and larger health centers. But I eventually, during COVID, ended up in a community health center, which is different. The need was far greater, and the health center actually helped me with getting certified as a dental assistant. So I took the course work very similar to what was already explained for dental assisting. And then the community health center had helped fund the testing that was necessary for the national board exam. So then I became a certified dental assistant, and that's kind of how I ended up on the path of going from just a on the job training type trade school to getting certified. Next slide. So this was very powerful for me. I really believe that fear kills more dreams than failure ever will. I was terrified of college. I was terrified to go through the program that I did for dental assisting. I chose not to go through a hygiene course because they had said I had to give injections to my classmates and then they would have to give injections to me. And when I say injections, I mean like shots. And because I had so much fear in dentist, when I was in the dental office, I really did not want to do that. So I chose to just stick with dental assisting, and I did that for a long time and I really enjoyed it. But once I decided to go towards a dental therapy role, I really had to kind of conquer that fear. So I really wanted to showcase this as being something. Don't let your fears just mess with your dreams, because this is me getting anesthetic from a student, nonetheless, her very first time ever giving an injection on a human, and it was me. So I was able to conquer that fear, but I just wanted to state this because it's really important. If it's something you want to do, you can do it, and you can get over the fear of doing it, because I did. So, next slide. So after dental assisting coursework, I was looking into different schools to go back and try to get registered as a dental assistant. And among, trying to navigate how all of that worked, I stumbled upon a program called the dental therapy program that was offered in either Alaska or in Washington. And I applied to both and ended up getting accepted into the Washington program. So this is just an example of what our simulation lab looked like. And then the second picture is what our clinical site looked like. So the first year is spent primarily working on like your prerequisite classes. You spend a lot of time in the sim lab, and then you have lectures, and all of that is held at the Skagit Valley College. And then the second year, you go through clinical portion, lectures, and most of that is held at the Swinomish Dental Clinic. And then the third year, you are kind of traveling to different community rotation sites. I participated on a mobile dental unit, very similar to one that was pictured in other slide. I did a preceptorship experience in a tribal health clinic. So you have a lot of different opportunities to just see how other places work as a team, and where you're going to kind of fit in. So next slide. This is a photograph of the Swinomish Dental Clinic. A portion of it is an active dental facility, and then the other side of it is our student patient clinical setting. And so the Swinomish tribal community, they had partnered with the Skagit Valley College and made this opportunity possible for students. So I was able to apply for scholarships and financial aid. And I just encourage you guys to really apply for any kind of scholarship you think you might qualify for, because I know that college can seem overwhelming and really expensive, but if you apply for scholarships, it's possible to have a good portion of your schooling covered. So like it was mentioned a couple times, Delta Dental had, they heavily supported my educational journey. Michigan Primary Care Association, the Kellogg Foundation, Indian Health Service, the college that I attended had different scholarships that they offered every quarter. My tribe, Sault Ste. Marie Tribal Education Fund, had different scholarship opportunities, and then again financial aid. And there are loans that you can get with repayment programs as well. But ideally, you want to try not to have any debt if possible. That's the goal. So next slide. So almost half of the world's population suffer from oral diseases. I really feel like this is really important reason why I really love dentistry. And I feel like it was outlined just beautifully in previous slides that, what we do is incredibly important. So we treat a lot of different areas of dental caries, which is the tooth decay, which there was a beautiful picture of what your teeth look like if they're decayed. Gum disease, which is how we take care of your teeth and keep them in place. And then the oral cancer, there are some good pictures of that too. So this is just a good display of why dentistry is really important. Next slide. So what is the dental therapy role? A dental therapist is a licensed dental provider, and it's really identified mostly like a licensed nurse practitioner. So we provide phase 1 treatment, essentially, emergency services, routine care, so simple extractions, fillings, like I had mentioned before, minimally invasive dentistry. We focus on disease prevention. And I personally work with a lot of children. That's just something that I'm passionate about. And so I do a lot of oral health education, behavior management. I try to build really strong relationships with the families. And then I also participate in community, just like everybody else does, with the mobile outreach, the like bus option, going to the local schools, daycares, and nursing homes to provide any necessary care in areas that are kind of lacking dental providers. Next slide. So this is just an example of different outreach, and this was a mission trip that I participated in 2 years in a row. We went to Jamaica, and these are all of the dental therapists that I went to school with. So the dental therapists are required to participate in extra activities that help serve under served populations. That's our primary goal, is to kind of help where we're needed. And so this was just a really fun representation of how all of us have, really participated in different events. And of course, with all the kids too, as children are really important, but we see all ages. Next slide. And then this was a good opportunity that I had in Jamaica. We had gone around to all of the primary schools and taught all of the children how to properly floss their teeth. We did a demonstration for each grade level, and we reached over 1,200 kids. And so this was just something that was really memorable, and it's tremendously important. This is just something that I did outside of Michigan, but we can do it here, and we do it here, and all of us do that together as a dental team. So I just think that being a dental provider is one of the happiest things that I've ever done in my life, including being a dental assistant. My path is different than some, and I'm proud of that, even though it's not the traditional way of doing things. I just hope that I was able to showcase that there's a path out there for everybody. A typical like high school to college, and then dental graduation just wasn't in the cards for me. And then the same with going through college, and then going into hygiene wasn't for me. I my own path, and I'm excited for that. So I just hope that while you guys are thinking about what you might want to do in life, this brings you joy and you think about dentistry and making other people smile. Thank you.
Thank you, Dana. That was excellent. I really appreciate what you had to add. Um, you know, working in dentistry just in of itself, I'm not in the dental field, but I do know from speaking to a lot of dental providers at UGL, and in my experience working with AHEC, is that oral health is so important. I'm a nurse, so I'm not in dental, but oral health is so important to just, a person's image and how they feel about themselves and how comfortable they are. And it affects many other things, not only that, physical aspect of it, but in the outward image, but it is so important for just general health. There's been, research studies, how it's, important that individuals have good oral health and oral hygiene, because it can lead to, many other, diseases in the body. And it shouldn't be considered different than medical health, so hopefully one day it's just part of regular insurance. But anyways, thank you everyone who has talked so far. And just to emphasize, that it's such a needed area. I mean, the health provider shortage area, or the HIPSA, that Dr. Collazo mentioned, is, obviously in crisis mode, and there are programs available to help with that. So a lot of the scholarship and loan reimbursement programs that Dana had mentioned and Dr. Collazo had mentioned, Sean Boudry is going to speak about next, and talk about a little bit of that, and what's available to people who come back and serve rural communities. So why not have our own local youth take advantage of some of these scholarship and loan repayment programs, if they're going to come back and work in our area anyway, in a HIPSA area. And I think that instead of having individuals from out of the area take advantage of these programs, come back and only provide a service commitment of 3 years, I think that, opening up the door to our own local youth who can take advantage of it, and then who may stay and, practice and work in the community for many years. And then Delta Dental is doing a lot to help address the issue. So as of right now, I'm going to pass it over to Sean, where he can talk a little bit about the scholarship and loan repayment programs that are available if you are to work at an FQHC or organization similar to Upper Great Lakes Family Health Center.
Good morning, I guess. I've been with Upper Great Lakes here for a couple of years now. I came from the medical side, and when I first came, right now you're getting more information that I had when I started doing dental. I didn't know the difference between a dental hygienist, dentist, and then in the last couple of years, the whole dental therapy. So, you're ahead of the game. What I would suggest, I mean, if you want to go into the dental field, spend some time in a clinic, get permission to kind of see the different jobs, where you want to start. And everyone kind of mentioned their own path. So part of that path is, a lot of scholarships, apprenticeship programs. And then on the national level, not so much just the state, with Delta Dental and everything. They have the National Health Service Corps, which does medical and dental scholarship programs. They do reimbursement. So let's say you're in school and you want to go into come back to your community and serve it. And from that map that Dr. Clausel had up, you could see the Upper Peninsula, northern Michigan, and then if you expand out, you're looking at Wisconsin and different areas. Wherever you go, you're going to find these areas of that need good providers. So if you know that you're going to go into public service or in, high need area, you can apply for these scholarships. And then each of the schools may have scholarship programs, but on the national level, it kind of opens it up a little bit more, looking at the HISPA areas or the high need areas. You can apply for a scholarship. And I apologize, I'm dealing with allergies or a cold, so my voice is getting shot. But the scholarship programs are for like when you're in school, they take care of it. And then afterwards, you hear about a lot of loan repayment. So with the National Health Service Corps, you can apply for these scholarship or loan repayment that give you a set amount of money, which changes year to year. But it's a 2-year obligation or a contract with the federal government saying that you're going to work in this clinic. That is a need clinic, and those that's can be continued also. And then with the there's also a program with the federal government if you're public student loan repayment. So after 10 years, whatever you have left, it'll get paid off. You just have to go through some paperwork as you go. And then some of the other programs, not everyone's going to go into dental. So there's nursing programs, there's physicians, there's PAs, all these different categories of providers and assistants that you can get scholarships for in loan repayment. So that kind of gives you, it's always changing. They're always adding additional programs. I mean, right now, with the dental therapy, which is a um, new program in the US. It's been in Canada and England for years, and also Australia, but it's more known. I'm old enough that so I know that back in the 80s when nurse practitioners and PAs were coming on board, a lot of physicians were against it, but there's a need out there that there's not enough dentists, there's not enough doctors. So we have different avenues that we could go to um, help you pay for these programs. And also, if you decide on going to a program, you can also look for if you sign up to go back to that program, you can sign up for stipend programs, which gives you some money every month to help with your day-to-day living or pay for school. So there's lots of programs. Always ask, depending, no matter what program you go into, if it's from nursing program to dental hygiene, or like we have our apprentice program where we pay for it. We just want good quality people to kind of, the saying is grow your own, and we want people to stay in the UP and be able to have a good life and take care of our community. So those are all things to take a look at when you're deciding on your career path. So I think my voice is gone, so I will, if there's any questions at the end, I'll do my best. Thanks.
Th- Thank you, Sean. I appreciate that. And yeah, I've shared this out with many of the, advisors and health career instructors, but I will, following the presentation, I'll email the flyers out. It includes details regarding where you're able to work, so eligible organizations and eligible disciplines. Quite a few of them have, dentistry on there. So, and it's a very lucrative career to go into. So the return on investment, you don't want to worry about the loans because you'll be fine. I mean, they get paid well, but you might as well take advantage of some of these programs that other individuals in the country are taking advantage of. And then just come back and work in our communities. And I just want to add, working as a nurse in healthcare and working for an organization, nonprofit healthcare, a federally qualified health center is really truly mission-driven work, and it feels good. It feels good to work in an industry where you're making a difference in people's lives. So, I only work clinically a couple days a week personally. A couple days a month personally, but what I do with the Area Health Education Center is very mission driven. And I think working for just Upper Great Lakes Family Health Center in general. It's just so important to do something that feels good and you feel good at the end of the day when you go home. So I just wanted to add that little bit. But I'm going to open it up to questions and answers. And then at the end, I'll talk a little bit more about how you can get connected. So if anybody has a question, feel free to unmute yourself, or I don't know, Amanda or anybody else who's on the line. If you have a question from the greater group there, feel free to unmute and ask that question. Do we have any questions? Doesn't look like it. Well, if there's no questions, does anybody else have anything to add before I move on to the last slide?
Shelby, I have one question.
Oh, okay. Thanks, Amanda.
Do you have opportunities for students less than 18 years of age? Could they work as a dental assistant in your clinics?
So at Upper Great Lakes Family Health Center, we do hire starting at 17. So if someone's 17, I know off the top of my head right now, our HR director is comfortable with hiring somebody who is 17 years old.
Okay.
So, any other questions?
Anybody else have a question?
Does the apprenticeship program cost anything?
The question is, does the apprenticeship program cost money for the person?
No, Upper Great Lakes Family Health Center would cover the cost of that. So, and then you would be, so we would cover the tuition and anything, you know, you might need for that. And you would start working and getting paid while doing the hands-on on the job training. And then you're also an apprentice with the US Department of Labor. And what that means is that you're eligible for supportive services. So you'll get a computer covered for the coursework, scrubs, shoes, you know, if you needed some sort of quick reference guides, study guide practice test package. These are just examples of things. I mean, we've even had learners get support with like backpacks, car repairs, childcare, that kind of stuff. But that, you know, would be reviewed in further detail with your case manager, because UP Michigan Works functions as our intermediary with the Department of Labor. They're using state and federal grant funds for it because, you know, we want to keep people in the workforce, and apprenticeship models are proven successful. So I will talk about that in further detail at, you know, an info session. That you're welcome to join. I hope that answered your question.
Yes,
May I add on to you, Shelby? So like my caseworker through Michigan Works reaches out to me quarterly and just make sure that I'm still employed with Upper Great Lakes Dental, just to check in and see if there's anything that I need. So they're very supportive and helpful to working with them and getting everything that you need from them.
Thanks, Emily. I appreciate that a little bit.
and then two more questions. What is the difference between a registered dental assistant and a certified dental assistant?
So I actually don't know that, but maybe Dana, do you know that?
Yes, I do. So a registered dental assistant, the certification just shows that you are, I guess, really just competent in all of the dental assisting skills. And then a registered dental assistant has expanded functions. So there's a certain scope of practice for a registered dental assistant. So in most cases, specifically for Michigan, they can place amalgam fillings, I think single surface, composite fillings. They can help in other ways that might be needed in community health centers to kind of help the dentist or the hygienist or even the dental therapist see more patients, such as like applying dental sealants, and so they have like a specific scope that they're trained on so that they can help in other areas with like an expanded function portion.
Thank you. Appreciate that. Do we have another question?
The last question is, what is the length of education for each profession? Like for becoming a certified dental assistant, I think compared to a
So, okay, so with the certificate of completion, the apprenticeship program with the US Department of Labor is 1 year. So you will have access to the coursework for a full year, but a lot of people finish the coursework sooner than that. But you are labeled an apprentice for a year. But you can maintain your relationship with your case manager at UP Michigan Works for indefinitely, as long as you need that. But for the certified dental assistant, specifically, you have to have about 2 years of nearly full-time work experience before you can sit for and prepare for that certified dental assistant exam that Dana had mentioned. And I forget the number of actual hours worked, but it's a roughly 2 years, and then you can prepare for that and sit for that exam. And then once you pass that exam and get your CDA is when you can move on to the registered dental assistant model that I briefly mentioned. And the program that I like to promote is the one with Washtenaw Community College, which is downstate, but the hybrid program is great because it allows you to only go downstate for 1 weekend, and then for the midterm, they'll come up to the UP, and it's only 1 semester. 1 semester program, and then you would be eligible to sit for your RDA. And Dana did a really good job of explaining what the difference is between a CDA, so a certified dental assistant, and a registered dental assistant. So that's a career path opportunity. Registered dental assistants have a little bit more ability to do, different skills in the clinic. Actually, seems like quite a bit more.
And then does the dental therapist, is that a master's level program? I guess I missed that.
So yes, it is, but there are, and I'll let Dana speak to this too, but it's relatively new in Michigan, but there are multiple career pathways like accelerated. So if you're already a dental hygienist, there's some programs that are, quicker to get in. There are also some that you can, I believe, enroll in as a dental assistant. But I'll let Dana speak to that.
So with dental therapy, because of the shortage, there are several different avenues as far as how to become involved in the educational journey. I know Minnesota has different criteria than Washington, and in Vermont is different. So very similar to like the requirements, to get into dental school and hygiene school, they have their own specific requirements, and then you would receive a certain degree based on whatever their educational journey is. But essentially, the highlight of all of it is that you want to be involved in a program that is CODA accredited. If you're not enrolled in a program that's CODA accredited, then you wouldn't be eligible for state licensing, which is what's necessary to work in a federally qualified health center. And that's really where we need dental therapists and all dental providers. So I want to make sure that's clear. There are a ton of different avenues, but you want to really make sure that whichever one you choose has a CODA accredited program. And some do graduate with a master's in dental therapy, and some graduate with just a associate's degree that you have all of the credits necessary for a master's degree. They're still trying to figure things out. So you just kind of have to figure out what path works for you when the time comes.
And Amanda, I will try to get a little bit more information from Misty Davis with the Michigan Primary Care Association, who is leading the implementation of the dental therapy program at Ferris State University. I'll try to get a little bit more information about the different pathways that are available, because it's not cut and dry, like it takes 4 years or something like that. You know, because with dental hygiene, most of those programs are 2 years, a 2-year associate degree. You know, the ones that I have looked into anyway. So if you had that and then moved into an accelerated program that was 2 or 3 years, you know, that could be 4 or 5 years depending. So that's just an example, but I will try to get some information from Misty Davis to see if she's able to differentiate you know, the pathways between the current schools that are available for dental therapy, and maybe a little bit more about what Ferris is going to be offering.
Okay, thank you.
Do we have any more questions?
Nope.
Nope. Okay. Does anyone else have anything more to add that I may have missed that you want to just chime in with? Any of the presenters? No? Okay. So here is my contact information. I will try to send the slides out following. I tried to earlier, but it's 62 slides long and it was a little bit too big, so I might have to send them individually. But I just wanted to say thank you everyone for attending, and thank you to all the presenters. I really appreciate your help in this initiative. Dental care in the UP is in crisis mode. I mean, dental cleanings. I mean, at my personal dentist, I have my last appointment was in July and I can't get in for a cleaning until this coming October. So it's pretty ridiculous. So thank you for helping me with this initiative. If you have any questions following this or need additional information, here's my contact information. If you're interested in shadowing and getting into the clinic and learning a little bit more about what each discipline does, you can shoot us an email at upahec@uglhealth.org. And Sharon Shiflett, our Workforce Development Coordinator, will help get that initiated. And then just to see what positions are available on the website, you can check out the UGL Health career webpage to explore open positions, to, you know, keep your eye out to see when the next dental assistant apprenticeship position is open and we're ready to fill it. So I think that's everything I have to say for today. And there will be, I mean, we recorded this, so I'll share out the recording eventually via social media and via email. So we can wrap up. Thank you. Thanks again for attending today. I appreciate you guys.
Thank you, everybody. It was great.
Thank you.
Yep. Have a great day.
Bye.